What's up, guys? Welcome back to the channel. Thank you so much for tapping in when you saw this video. So people across the country are getting messages telling them that they need to go pick up their parents from nursing homes, right? Because these nursing homes are shutting down, and it's all connected to the Medicaid and Medicare cuts, the funding cuts, right, under the orange man's, i.e. Trump, Trump's big beautiful bill, so called, right? Anyways, let's get into these clips and we'll come back and talk some more.
Have you heard all the stories on TikTok about nursing homes closing because of Medicaid cuts? Nursing homes are closing because of Medicaid cuts. I thought you were trying to get rid of waste, fraud, and abuse. Well, look at this. Tennessee, this is an FAFO for you, the red state of Tennessee, who voted for Donald Trump and is now going to have up to 12 nursing homes immediately closed due to cutting of Medicaid. There are 78 million Americans on Medicaid, 20% of the population.
The nursing home that my dad is in is ending their Medicaid contracts, and he has until September 15th to figure out what to do. And so I've just been down the rabbit hole to try to figure out why would a nursing home end their Medicaid contract.
Well, let me save you the trouble. It's called the Big Beautiful Bill. You know, Project 25, that you all said it didn't exist. Well, it did. So this is severe case of FAFO. Yes, the nursing home is severely filled with over 80% of the patients on Medicaid. And when the budget cuts happen, they have no other choice but to release the patients that are on Medicaid because they cannot afford to pay their bills. So move those little kiddos, combine them in one room, because you have to make room for Mima and Papa because they're coming home to you.
When he cut those funds, a lot of facilities lost the money that they relied on, right? And now they can't afford to keep caring for elderly residents. Families are suddenly being told that they need to take their loved ones home, even if they're sick, even if they're disabled, and even if they need 24-hour care. And this is causing a lot of online discourse. Anyways, let's keep watching.
Yep. Them nursing homes finna not take Medicaid, so y'all better get them rooms ready for Mima and Papa. Yeah, combine them kids' room. Get rid of the den, man cave, whatever y'all got, scoot it over, because Mima and Papa is coming to the crib. I don't want to hear nothing. This is not what I voted for. Yes, this is absolutely what you voted for. Okay? No, I don't want to hear any of that. Mima and Papa will be at the crib in 30 to 45 days. All right? Yeah. Yeah. That's where we are. And listen, before you get in my comments with that red, blue, left, right, I don't want to hear none of that, bro. You can put that Trump hat and that shirt on your Mima and Papa, but they coming to the crib. You can best believe that. If your in-laws use Medicaid, a lot of these services are going to not accept Medicaid. So yeah, make room.
Because of that wonderful, our big, beautiful bill, nursing homes are discharging residents who rely on Medicare or Medicaid because they won't be able to pay. Why? Because those programs are being gutted by funding cuts. Most of the residents are there because Medicare and Medicaid pays for their care. So without that funding, these facilities can't survive. They will kick people out. When the money disappears, they close. They don't care for your loved ones for free. They'll send them home to you. That means you quit your job, lose half your household income, and then all of a sudden you're the full-time caregiver. And then when thousands of caregivers leave the workforce, When nursing homes shut down, the economy takes a hit. This whole thing's not just about politics. It's about whether your parents, your spouse, your kids will have the care they need when they need it. People voted for this. Medicare and Medicaid cuts don't just hurt the elderly and the disabled. Believe it or not, they hurt every single one of us in some way.
Okay, just found out this afternoon that the nursing home that my dad is in is ending their Medicaid contracts. And he has until September 15th to figure out what to do. And so I've just been down the rabbit hole to try to figure out why would a nursing home end their Medicaid contracts.
So it's because of the big, beautiful bill. I'm going to save you the trouble of going through a deep dive. That's why this is happening. Because I don't think people realize that 65% of nursing home residents are covered by Medicaid. So what did y'all think was going to happen when Congress just passed the big, beautiful bill and Donald Trump signed it into law, which had nearly $1 trillion worth of Medicaid funding cuts in it? I mean, it's going to shift the burden of cost over to the states, and a lot of states are not going to be able to eat that cost without jacking up taxes or cutting other benefits, so they're going to cut Medicaid funding. And nursing homes have to respond to that. So the way they're going to respond is a couple of ways. One is they're going to just restrict the amount of Medicaid patients they accept into their facilities. Two is that they're just going to boot out already existing Medicaid patients to open up those beds for private pay patients so that they can still make money. Or they're just going to shut down entirely because they can't function without that Medicaid funding. Any of those scenarios is just going to be devastating to the vulnerable patient population that requires skilled nursing facilities for care. Those are elderly patients and disabled patients. And what's going to happen to those patients? You can't just throw them out on the street. A lot of them are just going to have to go back home and live with their families, who are going to have to figure out how to make that work, how to provide the skilled nursing care that they were getting at a nursing facility at home. A lot of patients who are in the hospital, who are ready for discharge, who would normally go to a nursing home, they're just going to be sitting in the hospital till we figure out a way to get them home safely. And that's going to cause a lot of delays in care because it's going to cause backup in the hospital, and patients are going to be waiting in the emergency room, and emergency room waits are going to be longer and longer because the hospital just can't discharge patients because they have nowhere to go. So this is a direct result of the big, beautiful bill that Donald Trump campaigned upon that was in Project 2025. And elections have consequences, and despite knowing all of this beforehand, a lot of people still voted for it. A lot of people who have elderly parents in nursing homes. So this is going to impact every single one of us. And I don't know what to tell you, but it's because of the big, beautiful bill. So there you have it.
He has a gun, honey. Excuse me. You saw him with a gun? Yeah, yes, I did. And y'all need to get over here. What the hell is y'all doing? We done called 500 times. You finished giving me the description. What color is the Infiniti?
All right, let's have an uncomfortable conversation real quick because it's on my mind and I can't run from it no more. So y'all know how a lot of these people in the nursing home finna get sent home. Now, my issue is a lot of them parents from back in the day was horrible to their children. They was horrible to their children. Their children have been waiting for the day to put their ass in a nursing home. And now you telling these kids that are surviving the trauma that these parents have put on them, saying that we finna put these people on your porch and you gonna have to take care of them. You thought the nursing home was whooping their ass, okay? I truly believe elder abuse is about to go through the roof. I am scared for these old people. And this is why you got to do right by your kids, okay? Because now your kids gonna have to take care of you. Man, just imagine. Just imagine. And it's a certain demographic. I'm not gonna speak on it because it could happen to anybody. But when they don't like what you got going on, they will kill your ass. I'm just telling you what I know. So if you got beef with your parents, you need to go down somewhere and tell them, look, this shit, I got PTSD from this bitch. I don't know if they can move back in. We got to do something about it because the elders are in danger. They are fucking in danger. And please don't let them be in a situation where they need to get rotated. They're going to be stuck to motherfucking beds. Listen, it's going to get ugly. And moral of this story is, do right by your children, okay? Because if they got, for whatever reason, If they got to take care of your ass, you don't need them to be getting payback from 40 years ago, 50 years ago. You don't need that, okay? Because them tables always turn. See, you thought you was safe in that nursing home. You thought you was safe. That bitch holding on from when you put her on punishment for whatever back in the day. She finna take your cane from you. We need to get some help on the line. The elder abuse is finna be out of control.
Those who are on Medicaid or have family members, specifically elderly family members on Medicaid, it's time to pack it up. Go on and go ahead and schedule that U-Haul because you got to pick up Nana and Pop-Pop, okay? You got to pick them up because word around the street, and I actually have close friends have confirmed this, there has been notices that has been sent to family members to come and pick up their moms, their grandpas, their great aunts, if they were on the paperwork, because Medicaid, if they were using Medicaid to pay for their estate, is no longer being supported by these nursing homes. Let that sink in. The new administration says, unless you have private insurance or the moolah to pay for your elderly into the nursing home, then they're not going to be able to pay that tab on Medicaid. And before y'all say, oh, well, that applies to the immigrants and the Hispanics and stuff like that, let me tell you something. Abuelita live in the house with the family. Abuelita don't live in the nursing home. They take in their abuelita, okay? She got a room and everything, even if it's the kids in the room with her. They are living with their family members. So majority of the people who are on Medicaid in the nursing homes aren't the immigrants. They are the Americans. So go ahead and pack it up. Call the U-Haul. Get your boxes because it's time to pick them up.
So the big crappy bill passed. What next? What next? Well, we are already seeing repercussions. The very first hospital in Nebraska, which by and large goes red, not that all people that live there vote red, but the state by and large goes red. The first hospital has announced its close. Yes. 1 in 4 nursing homes will close. Will close. That's not a guessing game. That's what will happen. %, of pregnant women, approximately, are covered by Medicaid. 80%. This bill that was tailored for less than 40 people in this country to hurt millions of people in this country. And this hospital in Nebraska is just the first of hundreds of hospitals that will close due to Medicaid cuts. That's not fear-mongering. That's math. The numbers don't add up. They don't add up. Medicaid isn't just for the people that are on Medicaid because of whatever extreme circumstance put them in the position to need Medicaid. Medicaid subsidizes so many hospitals around this country and doctors' offices and nursing homes. The crazy part is some people don't even realize they're on Medicaid because their card does not say Medicaid. Be prepared for what's to come. This is going to cause mass layoffs on top of the fact that people will not be getting the health care they need. MAGA is responsible solely for this. Solely for this. This is a MAGA bill. This is a MAGA-backed bill. And all of you cheering for this, watch for your premiums to rise, because that is what is going to happen. And lots of jobs are going to be lost, as well as lives.
So this isn't just inconvenient, right? This is dangerous. Some families don't have the time, they don't have the money or the emotional bandwidth to take care of elderly parents, right? Many aren't even on good terms with them. And that means that we could see a rise in elder abuse, neglect, and preventable deaths, right? And this is the ripple effect of policy decisions people didn't think would touch them personally, right? Anyways, credit to all the original creators of the videos, and thank you so much for tapping in when you saw this. My question for you is, do you think that families should be forced to take in their elderly parents, if nursing homes close? I feel like the answer to that is pretty straightforward, right? It's a yes, right? I don't think they need to be asked to. I think that should be something that they would willingly do. Those are their parents, right? Except maybe you have a bad relationship with your parents or something of that sort. But yeah, thank you so much for watching this video, and I'll see you on my next one.